we perform focused ultrasound ablation to the tumor that we're going to take out, and then also give them the standard of care immunotherapy. So we're sort of hitting them with multiple strategies to see if these could be synergistic and we can improve the number of patients that respond to standard therapy.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. Every year, more than 100,000 Americans are diagnosed with melanoma. The rapidly growing nature of the disease makes it particularly dangerous, and the disease is responsible for the majority of skin cancer deaths. Dr. Lynn Dengel is a board-certified and fellowship-trained surgical oncologist at University of Virginia Health, specializing in melanoma. She's testing the potential of focus ultrasound used in combination with immunotherapy to treat patients with melanoma. She also specializes in the treatment of various breast diseases. Dr. Dengel has authored and co-authored several articles in leading peer-reviewed publications, has won several awards for her research, and also serves as the senior advisor to the Cancer Immunotherapy program at the Focus Ultrasound Foundation. Welcome to the podcast, Lynn.
Thank you, Allison. I'm thrilled to be here with you.
So what inspired you to pursue a career in the medical field?
I was interested in science from a really early age, and I'm also tend to be a problem solver. So I like to work on challenging problems and often with a team. And field of medicine allowed me to do those things. I also really enjoyed the service aspect of medicine and always had a passion for doing service work. And so medicine allowed me to do what I wanted to do intellectually, but also provide an opportunity to give back.
Was there a reason you wanted to specialize in breast disease and melanoma?
Absolutely. Breast disease and melanoma you could really put under the umbrella of surgical oncology, which is a field that I found really incorporates many aspects of medicine. So one of the awesome things about medical school is medical students are given the opportunity, or perhaps forced, to go through different rotations and experience fields that they may or may not have thought they would enjoy. And when I went through my rotations, I actually liked many of the fields. And so I had a hard time selecting exactly what I wanted to do, and found that surgical oncology, while it's a surgical field, and I really found that I enjoyed procedures. I liked being in the operating room, and I had a sort of a natural skill for working my hands. I also really liked the aspects of medicine that allowed you to work with patients and provide patient education and make decisions with patients and really get to know your patients and think about the whole problem. So surgical oncology is a multidisciplinary field. And by that, I mean, we are working with medical doctors and radiologists and pathologists, and we all work together to solve a problem. So it inherently lets the surgeon sort of use all those aspects of their brain in training in terms of developing a plan for a patient.
Is there a point where you heard about focus ultrasound in your residency, or did that come later on?
Focus ultrasound came later on. During my residency, though, I started doing research with my mentor, Craig Slingloff, at the University of Virginia, who's remained an amazing mentor to me. And even before immunotherapy was as well known as it is now, he was working on immunotherapy for many years, decades, really. And in his research lab, one of the problems we were trying to improve upon was the ability of the immune system to counteract some of the strategies that tumors use. So tumors are super smart. And the reason that they can grow inside of a human with an active, healthy immune system is because they have ways to get around that immune system. And in his lab, we were working on different mechanisms, some involving injections of local immune agents into a tumor to try to see if we could break up some of these boundaries within the tumor. And then Craig had heard of focus ultrasound through some of our basic science and translational science research partners like Tim Bullock and Natasha Shabani and Rich Price, also at the University of Virginia, and as a potential to utilize focus ultrasound as a local treatment, not just to kill the tumor, but also to potentially alter the environment in the tumor so that we could have a better result from either a patient's own immune system or from drugs that they were getting as part of systemic or whole body immunotherapy.
And you're currently leading a clinical trial at UVA Health using focus ultrasound in combination with immunotherapy for melanoma patients. Can you tell us more about that study?
Sure. I'm thrilled to be doing this study. So I saw patients in my own clinic who had
melanoma that we were going to take out in the operating room. So in this specific scenario, a patient would come in with a mass that you could sometimes feel, but certainly you could see on their imaging. And it would be either recurrent or more advanced melanoma. And the standard of care is to give these patients immunotherapy, so to give them an IV checkpoint blockade that essentially helps boost their immune system. And then we, under normal circumstances, then just take the mass out and see how the immunotherapy worked. But we know that there is a significant percentage of 40% or more patients who don't get the optimal response from this therapy. And in seeing these patients in the clinic, they had disease that I knew from this other study could be treated with focus ultrasound. And so it's a really cool combination of what I learned from this other study and the way we treat melanoma patients, where we're able to enroll these patients in the study. And really with only one extra real treatment visit, we perform focus ultrasound ablation to the tumor that we're going to take out, and then also give them the standard of care immunotherapy. So we're sort of hitting them with multiple strategies to see if these could be synergistic and we can improve the number of patients that respond to standard therapy.
How many patients have you treated so far? And is there any specific criteria for the patients who are selected for the study?
So we have treated 2 patients so far. The study just opened in the fall, so I've been thrilled with that. The criteria for these patients are patients who have resectable melanoma, meaning that we are going to surgically remove the melanoma, and it has to be either a regional or distant metastasis. So we're not treating their primary tumor. Melanomas, as you might imagine, are quite thin on the surface of the skin, usually the primary tumor, and those wouldn't really be a good candidate for most of the current focus ultrasound ablation techniques that we have access to. So what we're treating are more like masses that come up in their lymph nodes or that come up underneath their skin and their soft tissue. And so patients who have these types of masses from recurrent or more advanced melanoma that we are planning on removing. And they also have to get systemic immunotherapy. So there are some patients who aren't candidates for systemic immunotherapy, but we really wanted to see the synergistic effect of these 2 options together. So they have to be getting systemic immunotherapy with a plan to then remove the mass.
What are some of the challenges with incorporating focus ultrasound in immunotherapy?
I think the main challenge is really just being at an institution that has the device that fits the need. So, for instance, the device that we're using for this study works really well for melanoma because it's better at treating lesions that are closer to the skin, not things, let's say, in the liver that are super deep. And so we have to match the device that we have with the problem that we're trying to address. And so if I was trying to ablate melanoma tumors in the liver, right now I don't have access to a device that would do that.
And how will this new treatment impact patient outcomes, or what's the hope?
Right, exactly. So, of course, we don't know yet, right? But the hope for this trial is based on preclinical data and other findings from other of our colleagues about the changes you can see in the environment from focus ultrasound. So this goal of not just burning the tumor, but actually when you ablate or burn the tumor, then creating an area around that within the tumor that's altered, but not fully ablated. And that is hopefully an immunogenic environment where we get more immune cells to come in and benefit from the patient's immune system or the immune therapy that they're getting. And so the pathologist that I'm working with, Dr. Gradecki, she's wonderful. And so we personally take these tumors after I resect them and look at them and take generous samples to allow us to really look at the impact of focus ultrasound. So we don't have these results yet, but I'm really hopeful that because of the way because we are removing these tumors and we're going to be able to really look at their pathology quite extensively, that we will learn a lot about what's going on in the microenvironment of the tumor after patients are treated with focused ultrasound.
You've also focused on breast diseases, including breast cancer in research. Can you tell us more about this area?
Sure. So the research I'm doing in breast cancer myself is really around patient decision making, and it ties in loosely with the work of focused ultrasound, just in terms of my interest in having these conversations with patients and making informed, shared decisions together. I think it's really helpful when you're talking about a clinical trial, such as the one I'm doing in melanoma, to really take the time and be deliberate about the process of informing the patient about the potential risks and harms and the hope for what we may gain from the trial. Additionally, I am a collaborator on a study in the breast realm that's being run by my colleagues Patrick Dillon and David Brennan. And that is using focused ultrasound to treat breast cancers. And so I am enrolling patients and working with them also on that study of theirs.
Oh, that's so interesting. Can you tell us more about the details of that study?
Absolutely. So these are for patients who present with a primary breast cancer. So this is not, so these patients are earlier stage than the melanoma study. And again, the patients are planned to have their tumor removed. And so if the tumor meets appropriate size and is in a location that we can access with the focused ultrasound device, then these patients can get focused ultrasound prior to their resection to those tumors. And it has a similar goal of combining this with a drug that they get systemically to try and see if there is a synergistic effect and learn what this does to the immune system within the tumor.
And you've earned awards from the Conquer Cancer Foundation and the Society of Surgical Oncology. What was it like having your research recognized?
It always feels great because research is such a labor of love and it's a slow process. So I think sometimes we tend to get into our own deep tunnels and not necessarily realize how things are seen from the outside and maybe miss that they could have a larger impact. So it's always validating to have an organization honor your work. But I think really what I find the most surprising is how our patients are so grateful. Often doing a research study requires additional patient visits or paperwork or time for discussion. And while I think of my patients as really, doing sometimes of a service work on their own by participating in these studies, patients are incredibly grateful as they see it as an opportunity to get access to treatments that they wouldn't have at other institutions or off of a trial. So I think that's really the most rewarding, is when patients come back and tell you about their experience and thank you for the work that you're doing.
Can you tell us about your research team and any other external collaborators you work with?
I work directly still with my mentor, Craig Slingloff, who is a surgical oncologist and has a real focus in translational research around tumor immunology in the melanoma field. And then we have our medical oncologists who work with us on the immunotherapy concept. So they're the ones who are helping decide which drugs the patients will get before their FUS treatment and what regimen, and also helping to identify patients. And then we have an incredible research team of clinical research nurse coordinators who really are outstanding in talking with patients about the trial and really going through with a fine-tooth comb the process, the consent, all of that, so patients can feel well informed going into a study. And then once we get through the clinical aspects of the study, we really have this whole team of experts in focused ultrasound, some of whom I mentioned earlier, that run labs doing basic science, preclinical work in focused ultrasound and the immune outcomes, so they can help on the analysis side so that we can get the most information from our patient samples as possible.
And how has the foundation played a role in your work?
The foundation, of course, has funded the work, which is really obviously very important. We can't do this kind of work without research funding. And I think even more than funding, what I find with the foundation that's different than other funding organizations, it's almost like an incubator for researchers. It provides this network with other researchers focus on similar problems in other institutions. So it creates a very collaborative approach. It's not competitive. So people have shared protocols that they've written with me that are at other institutions, and I've shared my protocol with other investigators. And that is all through the Focus Ultrasound Foundation. They run workshops and webinars and really provide a platform and a place for researchers to share both challenges and also wins and successes, so we can keep moving together more at a more rapid speed than we would otherwise if we were all working in our silos.
What advice would you give to others who are considering a career in surgical oncology or who are interested in using focus ultrasound in their research?
I think for those considering a field in surgical oncology, my advice would be to spend as much time with surgical oncologists as they can and in different environments. Each surgical oncology division functions in a different way. And I think you'll never learn as much as you do by just spending time with your future colleagues or mentors and exposing yourself to the field. And for other investigators who are thinking about using FUS in their research, my advice would be to reach out to the foundation because they can provide so much guidance and support
in terms of what devices are available at their institution or locally, or who else they could collaborate with while trying to solve a similar problem.
Well, thank you so much, Dr. Dengel. It has been so great talking to you and hearing about all of this exciting, important work.
Thank you, Allison. I really, it's a joy to talk about the work that we're doing, and I really appreciate your time and letting me participate in this.
This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the Foundation, visit our website at fusfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.